Are we live? Good morning, loveys. How we doing? I miss you. I love your faces. And as usual, I have had technical difficulties with a computer. So I'm living on a prayer on this glorious Saturday morning, and it's 9:37. I'm late, for the love of God. Oh, we have comments. Humans! Hello, humans! My loveys. Let's go. Okay. So, babes, I don't know about you, but I just wanted to say that it appears to me potentially there's like a Mercury retrograde. There is also some sort of Pluto transition or something in Uranus because I am blacked out. I have had a week that you would not believe. Okay. So, the hits just kept on coming. But what I'm going to say is this is that to anybody who is going to not just be trolls, because trolls are normal, we know the trolls, but if you are someone who is just an asshole to be an asshole, and if you think that it's appropriate to give out people's employers where they work, if you think that you want to call my job just because you don't like what I say on a case, I just wanted to tell you that you look real weird, and it's just showing of the character that maybe you guys have, that some people have within themselves, because they call out in hypocrisy of saying like, oh, you people are bad. We're bad. I'm bad. I'm a terrible human being. But then they go and they have their people do the exact same thing that they don't like that is happening. Do you know what I'm saying? I don't know if that even made sense, but I just wanted to say that I'm good. Okay. And although Kevin said that I was uneducated last night on his stream, that hurt my feelings, Kevin, because, unlike you, I actually went to college, and, I am a little bit of, I don't know, an expert in the field of 17 years and a wound certified nurse and a legal nurse consultant. But you know what, Kevin? You, former bartender, you know more. And, how dare I? So, Kevin, gently, I just found something right here, right in my pocket for you. Do not sit on it and spin. Okay? All right. So, bam, let's go. Oh, let me shut this. I'm not in a usual location. Sorry, guys. We're in our PJs, just streaming together. Okay. So, all right. So, guys, here's the thing, is that I wanted to review with you because why? I love you. You're my best friends from out of town. And I was like, let's just show people who, what, where, when, why, and how, because we are educated human beings, because we look at testimony, we look at findings from pathologists, from neuropathologists, from medical examiners, from everywhere else. We hear the evidence and we understand that there is not a possibility for Officer John O'Keefe to have been sideswiped by a vehicle at 24 miles an hour to cause the injuries, as stated by Renee Stonebridge, who is like a badass, okay? Her with that sleeve, she came in, listen to me, when she walked into this trial, I know a lot of people didn't like it. They were like, ew, that's trashy. And you know what I thought to myself? I thought, bang, bang, bitch. Okay. I was into it. I was like, you're telling me she was going to college. She has like at least 8 years of education plus 4 years of specialty. And she's sitting here. She is an educated queen. And when she goes through these injuries, you guys, it was catastrophic. And before I get into it, I just want to say to you guys, this is going to be a little medical. This is going to be a little hoity-toity. You know what I'm saying? This is going to be a little mumbo jumbo. but I'm going to break it down. You know what I mean? As best as I can. And sip of the Diet Coke. Okay. I'm not going to go too far in the weeds with us, but if you don't like to talk about cranial fractures, if you have problems with subarachnoid hemorrhages, if there is, if you get a little queasy over that, then I love you so much and I will talk to you another stream. Okay. All right. Okay. Now let me say hello to everybody because I just ranted for 6 minutes. Good morning, Mindy. Good morning, just Chrissy, my Chrissy the Crone, who I'm so sorry that I wasn't available for your market basket run. That is rude. It shall not happen again. And classic overthinker. Hello, my lovey. Listen to me, okay? When did weddings start to, like, now we've got people that you just don't have a rehearsal dinner and a wedding. Now you have like pre-rehearsal mixes. You have welcome events. I said, these kids are doing it right. You're just getting parties everywhere. Then afterwards, there's a post-wedding brunch the next day before we leave. I can't. Okay. So I wasn't aware that I was supposed to be somewhere. And then when I got home, I couldn't figure out, when I got back, I couldn't figure out how to share the screen. You know how it happens, but I apologize, my love. And hello, good morning, A. Good morning, Nosy Rosie and BLT. Don't be hating. Love to see you. Okay, babes. Now let's tuck and roll. We're getting into a woman who is basically, in my humble opinion, the most, I don't know exactly. I feel like her testimony, Dr. Renee Stonebridge, that it is the most powerful testimony of all of the medical providers, right? I really did like, Scorty Bello did a good job too, kind of, but I'm just talking about for the Commonwealth. But Renee really knocked this out of the park, okay? And her not being cross-examined was, in my humble opinion, a mistake. Because if Alan Jackson and David Yannetti had expanded on what Renee had told us, had she said that these severe, multiple, diffuse, meaning spread out fractures that allegedly started from the occiput and the base of his skull and went all the way to his frontal lobe to cause several fractures. Guess what, guys? That rules out the fact that Officer John O'Keefe was a stationary man and he was struck by a vehicle. Because all of those fractures being everywhere and him only being hit in one location, and even if he went down on the ground that was frozen, allegedly, that caused it to crack, fracture, and lacerate his skull? Nope. Didn't happen. Lies. All lies. He's hit in one location, goes down to another location. There is no way that Officer John O'Keefe had the extensive trauma, fractures, and injuries to his body that are going to be explained beautifully by the one, the only skull sleeve, Renee Stonebridge. Let's get into it. I'm playing it, babes. Now, I think I have the screen on. Is it full screen? Okay, here, we're going to do it. We're going to get it together. Bear with me. Okay, on your mark, get set. Let's play, baby.
Do you solemnly swear that the testimony you shall give to the court and the jury in the matter now pending shall be the truth, the whole truth, and nothing but the truth, so help you God?
Yes, I do.
Great.
So once you sit, I'm going to tell you that you have to keep your voice up. We want to keep our air conditioning on. So just if you'd speak loudly into the microphone, that would be great. Yes, thank you. Go ahead, Mr. Lally.
Sorry, babes. Listen, I know this is so obnoxious, but I just had to say, because I saw Judge Cannoni, Did we hear yesterday that Judge Cannoni is getting literally a promotion? She's getting rotated out of her Raj, okay, regional administrative job or justice, whatever they are. And she is going to be directly under the entire, like the person who runs all of Superior Court. She is going to be one level below. You know, there you go, Bev. Just no good deed goes unpunished in our lives, okay? Like, what are we doing? She has had the Lopes trial, which was an absolute shit show for anyone from Massachusetts. And it of course, it's not her fault that the jury didn't get their shit together. But now she's had a second retrial, 2 years. She has been, in my humble opinion, not showing the most respectful or the most level judicial prudence that one would expect from a Raj of her stature. But, you know, continue, carry on. Good luck. Good luck. I hope you get a great pay raise, Bev.
Good afternoon.
Good afternoon.
Could you please state your name and spell your last name for the jury?
Yes, my name is Renee Stonebridge, last name Stonebridge, Stonebridge.
And what do you do for work now?
I am employed through the Chief Medical Examiner's Office at Boston as Director of Cardiac and Neuropatholgy and Medical Examiner.
Now,
Director of Cardiac and Neuropathology. Bitch, tell me more. Sorry. No, doctor, tell me more. I won't, but I was just excited. I clutched, you know. Oh, get pearls. Where's your pearls? That is, I mean, you want to talk about, I'm into it. Tell me more, Renee.
if I could ask you just a few questions about sort of your educational and work history background, if that's all right.
Yes.
Starting with your bachelor's degree, where did you go and what, if any, area did you receive a degree in?
So I went to SUNY at Stony Brook in New York. I was a double major in biology and Germanic languages and literature. I graduated with a bachelor's of science degree. After that, I went to the American University of Antigua for medical school, and I graduated with honors, magna cum laude. After that, I did a 4-year combined anatomic and clinical pathology residency program at NYU Winthrop Hospital in Long Island, New York. After that, I did a 1-year forensic pathology fellowship at the Boston office of the Chief Medical Examiner. And after that, I did a 2-year neuropathology fellowship program through Brown University at Rhode Island Hospital.
And doctor, are you board certified?
Yes, I am board certified in anatomic pathology, clinical pathology, forensic pathology, and neuropathology.
And if you could just explain to the jury a little bit about what.
Just an FYI, guys, if you're not in the medical field, for you to hold four different board certifications for her as a physician is, I mean, top tier. You win at life. You go, girl.
What does board certified mean?
Board certification means that every medical specialty has their own board. So for example, the American Board of Pathology dictates whether or not you can be board certified based on certain criteria. So you have to meet certain criteria, meaning that you have to complete a certain number of surgical specimens, a certain number of autopsies. And then once you meet that criteria, you can take an exam, which if you pass, leads to your board certification.
Now, if I could ask you just a couple, and your board certification is up to date at this point, is that correct?
Yes.
In each of those areas that you just spoke of?
Yes.
Now, if I could ask you some general terms as far as if you could define them for the jury. First of all, what is pathology in a general sense?
Pathology is essentially the study of any sort of disease or abnormal state of the body tissues. So anything that can go wrong in the body and any of the body systems is essentially the study of pathology.
And now starting with anatomic pathology, what is anatomic pathology more specifically?
Anatomic pathology consists of the study of surgical specimens. So for example, if someone goes to the hospital to have a tumor removed, that specimen will go to pathology. The pathologist will look at it, cut it, look at specimens under the microscope, order any ancillary tests.
Mel, good question. Sorry, just wanted to answer it as it came up. Mel says, how many doctors are board certified versus not board certified? I would think all doctors would need to be, right? You are correct, but you take one, okay? Not four. She is above and beyond and very, very educated, in my opinion.
If necessary, and then make a diagnosis, which is then conveyed to the clinician. Anatomic pathology also consists of cytopathology, which is looking at individual cells, and then it also consists of autopsy pathology.
And as far as clinical pathology, what does that mean?
Clinical pathology is anything that is lab related in pathology. So if you have to get blood drawn and then the results come back, that is clinical pathology. If there's any sort of blood work that needs to be done, for example, if you're going to have a surgery and they have to cross-match and type you in case of a blood transfusion, that's considered clinical pathology. Also microbiology, so anything infectious. So essentially anything that goes through a lab is clinical pathology.
And what is forensic pathology?
Forensic pathology is the study of autopsies in a medical legal sense. It doesn't necessarily mean that it's always going to be something that is legal. Sometimes it may be just a person who has not seen a doctor in many years, dies at home. There's no physician that is willing to sign a death certificate. So we work on those types of cases, plus anything that is non-natural.
Now, neuropathology, what is that?
Neuropathology is the study of the brain, spinal cord, eyes, muscles, and nerves.
And if you could, just again, in general terms, as far as casework is concerned, related to your work as a director of the neuropathology, can you explain to the jury sort of what it is that you do with respect to neuropathology?
Yes, so my job primarily entails me to be a consultant for the medical examiners. So the medical examiners have a certain set of criteria that they follow in order to determine whether or not a brain needs to be saved for a neuropathologic analysis. So upon following that criteria, if the brain is saved, it gets put into formalin, which essentially fixes the brain so it firms it up, so it makes it easier to analyze. So after the brain has been fixed, I usually let them fix about 2 weeks. Sometimes it could be a little more, a little less, depending on circumstances. I will then look at the brain, take photographs of it from all sides, and then cut the brain, take photographs, document any sort of abnormalities. And then if I feel the need to take sections to look at under the microscope, then I will take those sections. They will be processed through histology. I will look at the slides. Sometimes you may have to add in additional testing, for example, immunohistochemistry, to see if there's anything in particular that you cannot maybe diagnose solely on looking at the histology. And then once that is done, I will issue a report to the medical examiner, and then they use it in terms of determining their cause and manner of death, if necessary.
Okay, guys, so I just wanted to stop there. I'm so sorry, but this is like literally anyone who is medical in the chat right now. I'm going to need an absolute, like, we're going to have to do claps, right? Claps and 3 snaps, because Renee was in my opinion, she was just underutilized and underappreciated during trial. I went back and I looked at my TikTok spins, and I did like a love letter to her in her testimony and tried to break it down as best as I could. But, it was a short video, and this is imperative that we go through this, because Renee is who was called by whom? Dr. Scorti-Bello. Dr. Scorti-Bello saw the injuries on Officer John O'Keefe, and she said, I need to tag in a teammate, okay? So Renee is a step above, and she's a consultant who is going to come in and say, what went on here, because it was so extensive. The injuries to Officer John O'Keefe's brain, his brain stem, his dura mater, his cranial, like his lobes, everything was in such traumatic condition, guys, that we tapped in our quadruple board certified queen of the green, okay? And she is wearing her fake eyelashes and giving me life today. So sorry, let's get back into it.
Now, as far as that formalin process, as far as the solution is concerned, is there a typical time period that the brain would have to be in that solution prior to you examining it or cutting it or any of those other things?
Usually about 2 weeks, give or take maybe a few days here and there, but I usually try to let them fix at least 10 days minimum.
And again, in general terms, with respect to the types of cases that are referred to you, what types of cases are typically referred to you?
So part of the criteria that we use is that any cases for children or babies under the age of 2 years, those always come to me. Also, if there is any cases that have blunt head trauma that may be suspicious or homicidal in nature, those will typically come to me as well. Some of the other cases may be just a difficult neuropathologic entity that a non-neuropath trained medical examiner may not be able to really diagnose. And then sometimes there's cases that are just surprise cases where the medical examiner opens up the head and they see something interesting or abnormal and they decide to save that case for me to look at further.
Okay, so guys, when she is talking about babies under 2, unfortunately, God, rest every soul of a baby that is no longer here. It's horrifying. But though she would probably deal with shaken baby, okay? And that she would take those kind of cases, SIDS potentially as well. Also, then she is talking about homicidal trauma, blunt force impact, traumas, which is not typically seen in a motor vehicle accident. And do you know what she didn't say on the stand of cases that go to her? MVAs is what we call them, motor vehicle accident, pedestrian strike. You don't do that. When Dr. Scortibello opened up the skull and saw the extensive damage she did, guys, she had to call Dr. Stonebridge because it was not in alignment with what Michael Proctor said, Trooper Buchanan, and what the scene had told Trooper Paul. So let's get into it.
Now, with respect to the cases that you do see, at some point did you become involved in analysis or testing of a brain belonging to John O'Keefe?
Yes.
And who was the doctor that was the medical examiner that made that referral in this case?
It was Dr. Renee Stonebridge.
And with respect to your analysis here, obviously you looked at the brain. What, if any, other sources of information did you review or did you look at in ultimately formulating your opinion in this case?
So at the time when I was able to cut the brain of Mr. O'Keefe, I had information that was relayed to us from our intake department. So when a case gets called into the medical examiner, it gets taken by the intake department and they're given kind of just a rough summary of the case. I also had the police report, I had the EMS report, I had the medical records from when Mr. O'Keefe was in the hospital. I also had medical records from the primary care physician. I had autopsy photos, and I also had, I believe just refer to my notes here because I had a lot of notes. I also had the inventory and tracking sheets, which are notes created by the medical examiner, and the neuropath request itself.
Now, are you familiar with some terms in relation to injuries that you would observe as far as from a neuropathological perspective, as far as injuries being acute, subacute, or remote?
Yes.
And can you explain to the jury sort of what those are and what those mean?
So it depends on circumstances. Acute generally is something that happened within a very short time frame. So when I refer to something as being acute, I usually refer to that as something that's occurring from the time of an injury to maybe a day or so afterwards. As I said, it's variable dependent on circumstances. Subacute is something that has not happened within the last few minutes, few hours, maybe even a day, and maybe something that is now in the process of healing. And then chronic is usually something that has happened a while ago in the past. You may see some sort of evidence of some type of injury in a chronic state. You may also not see any evidence because it may have completely healed by that point.
Okay, what I found interesting about that, guys, is what she was saying about everything that she's going to document is going to be acute in Officer John O'Keefe. And I liked that she said within minutes, like that what she was seeing, the presentation was within minutes, or it happened at the time or minutes before. And I know that it's up to a day because it was only in theory. It could have been by prosecution testimony and theory, 6-hour window, right? 12:30-ish, 12:32, Officer John O'Keefe is allegedly struck by Karen Reed's 7,000-pound Lexus LX 570. And then she takes off, she's back home, and then Officer John O'Keefe is found at 6 o'clock in the morning, and the EMS is there by 6:07, I believe. So this is where we are going to get into the minute time. Oh, Mr. Nurse Kim, how we doing? Thank you, Lovey. Let's get a visit, girl. Okay. Oh, she's living her life. This is where we are going to see, in my opinion, that Dr. Stonebridge gives us, she wraps this in a bow, babes, and tells us that what she sees occurred very, very close to when Officer John O'Keefe was found and then subsequently pronounced. I would say within 4 hours. And I'm going to try to exactly pinpoint where we can get testimony out of her, that it would be around about a 4-hour mark. Incredible. Therefore, ergo, making Karen Reed factually innocent. Get some tea, you crazy broad.
And so from your analysis in this case, how did you characterize, in your opinion, from everything that you reviewed as far as the injuries you observed in Mr. O'Keefe's brain?
The injuries I observed were acute injuries, meaning that they probably occurred minutes to hours.
Now, if I could turn your attention to your findings as far as when you conducted your analysis and your testing in this particular case, what, if anything, did you find as far as injuries to Mr. O'Keefe's brain?
So when I look at the brain, what I do is I look at all surfaces from all sides. And one of the things that I look for is anything grossly obvious, meaning anything I can look at the brain and see that there's something there that shouldn't be there. So one of the first things I noticed was a subarachnoid hemorrhage. And subarachnoid hemorrhage is something that occurs when you have bleeding within the leptomeninges. The leptomeninges are a very thin membrane that encase the brain and the spinal cord, and there should not be blood freely floating within the leptomeninges. So if you have a subarachnoid hemorrhage, most of the time the causes are either a ruptured aneurysm, which is something I would see upon cutting the brain, or some type of trauma. So that was the first finding.
Okay, babe. So what we're not going to try to do is get lost in the weeds, right? And like this gets very technical. I'm going to try to keep us out. We're getting out of the weeds, but we're getting the fundamentals. You would either have an aneurysm, right? And an aneurysm is a burst of those of part of your brain, right? Of a vessel that is uncontrolled and then can lead to death if not treated immediately, right? So you can have somebody with, some sort of instant aneurysm and you can just absolutely pass away. You know what I mean? Like I've had, unfortunately, patients that did not come out. You can have even an aortic aneurysm, okay, which is down in your body. But if you have any kind of cerebral event that is is bursting in the way that an aneurysm is, this is huge, big doings. It only would happen via a mechanical situation and trauma, or a congenital, something that was going to happen, not congenital, but it was going to happen anyway, right? So this is something that is pathophysiology that was happening in your body at the current time, or there was a trauma that caused it. Don't worry, do not worry about leptomeninges.
Can I stop you there just for a second? Of those taking notes and for our court reporter, could you spell the type of hemorrhage and the membrane?
Yes. Subarachnoid is subarachnoid. And leptomeninges, leptomeninges.
Thank you very much.
You're welcome.
Now, with regard to anything related to the aneurysm that you indicated that you would have seen, what, if anything, did you see during the course of your review or testing or analysis of Mr. O'Keefe's brain?
So aneurysms are typically seen in the cerebral vessels that sit around the base of the brain. So there's something called the circle of Willis, which is the main arterial supply. It sits around the base of the brain, and it's kind of shaped like a circle that has vessels that come off that extend to other areas of the brain. So typically, if there is an aneurysm that is ruptured, it's going to be located somewhere in one of those vessels. So upon observing those vessels, I did not see any evidence of any aneurysm or any sort of natural disease state that might have led to a rupture in one of these vessels. Also, sometimes these vessels, since they do go deep into the brain, you may only see the rupture upon cutting the brain. And I did not see any evidence of any rupture of any of these vessels anywhere in the brain.
Now, as far as the subarachnoid hemorrhage that you observed, where was that located within the brain, and if you could?
So the subarachnoid hemorrhage was on the frontal poles, which is essentially right here in the front of the brain. So the frontal lobes obviously sit in the front, and then the poles are the very frontmost portion of the brain. So it was on the frontal poles.
Babes, we have red flags. We have red flags. How did Officer John O'Keefe, who was not struck in the head at all, right? Allegedly, per the Commonwealth's theory, he was struck in his arm, pirouetted, fell. Some of the Commonwealth supporters will tell us that he smashed his head on the street, okay? And then he bounced up and landed on the yard, because that would almost make sense of how he got his 2-inch laceration in the back of his skull, okay? Now, but if he wasn't hit in the front of his head and he hit it at the back, he hit his head on either the pavement, allegedly, or the ground, frozen ground, allegedly caused a 2-inch laceration. Impossible, but I digress. Why would he have had trauma and subarachnoid hemorrhages to the frontal poles of his brain? Tell me that, babes. You can't. Continue. Keep on keeping on, you queen.
It was also on the left temporal pole. So the temporal region is right here in the temporal region. And because of the way that the temporal lobe is shaped, it kind of has a little loop right in the front. So it has a pole as well. So it was on the left temporal pole. And then it was also in the left lateral fissure. So you have a frontal pole here. You have the temporal lobe right here. And then the lateral fissure goes kind of in between the temporal and the frontal lobes. So you have the hemorrhage here, and then hemorrhage right there. So it's kind of all concentrated almost in one area. But then there was also hemorrhage of the posterior surface of the right temporal as well. So on this side.
Now, doctor, I'm probably
Okay, Levy. So I'm sorry. I'm going to stop. I'm going to stop and I'm going to let her speak. But I want to also tell you, he's got subarachnoid hemorrhages in his frontal lobes. We also have temporal lobe, bilateral temporal lobe subarachnoid hemorrhages. What? And additionally, babes, that she said that it was between the left frontal and temporal fissure that comes, it's like the section in between so deeply, right? So between your frontal lobe and before you get to your temporal lobe, here is your left temporal fissure, okay? And it's on this side. Well, and we're going to say that he had all of that from being struck, sideswiped from a low speed reversed impact and smashing his head on the ground from a 24.2 mile an hour strike. Please kindly, gently, and securely fuck off into your own delusional fairy tale land if that is what you believe. Okay, you little hobbit.
Probably going to butcher this horribly, but just as far as the bilateral unci, are you familiar with that?
Yes. So the unci are the medial portion of the temporal lobes. So the brain is essentially oriented in a way that each hemisphere, the right and left hemisphere, are the same. The unci are the most inner portion of the temporal lobes. So the unci sit just next to the brainstem. So if you have anything that causes herniation of these unci, they start to push inwards onto the brainstem. So say this is the brainstem, here are the unci, they start to push in. And because the brain is within the skull is hard, you have no room for any sort of expansion of the brain. If there is herniation, it will start to push in that area because the brainstem turns into the spinal cord and goes out of the skull through the foramen magnum. So you have this hole about this big or so at the base of the skull where the brainstem turns to the spinal cord, then comes out. So that's one of the only areas in which the brain can actually move because it's encased in the hard skull. So if you have herniation, it'll start to push and then push downwards.
Could I ask you to spell unci?
UNCI.
And with reference to this bilateral unci area, what, if any, herniation did you observe?
So when the unci herniate, it can be subtle. Sometimes if it's herniated enough, you may see hemorrhages in the brainstem. And this happens because this tissue is now pushing on the brainstem and it's essentially being compressed. So there was herniation noted, and then there was hemorrhage within the brainstem.
Now, if I could ask you, Doc.
Loveys, this is the most kind of egregious stuff I have heard from a neuropathologist in any trial, right? Like, this is heartbreaking, to say the least. And the trauma and what she is reporting is what you would expect to see potentially in some of the worst traumatic brain injuries that have ever been reported. This would be something you would expect to see from someone who was like actually, killed in a homicidal rage with blunt force trauma, multiple impacts and blows to their head. For her to be talking about the hemorrhage in the brainstem, that is a finding that is so severe. I cannot express to you. For Officer John O'Keefe to have had herniation into pushing that pressure, that brainstem is hemorrhaging. It is trauma so great that like it physically makes me sad and uncomfortable to think about what happened to him. All right, let's try to find my place. I don't know what I did.
From everything that you reviewed, as far as the injuries you observed in Mr. O'Keefe's brain.
The injuries I observed were trained medical examiner may not be able to really.
Sorry, guys.
Hemorrhage within the brainstem.
Okay.
Now, if I could ask you, doctor, just to be familiar with the term or medical term known as a contusion.
Yes.
And can you explain just in general terms to the jury what you understand that term to mean?
So a contusion is essentially a bruise. It's blood that's coming out from a blood vessel. It's a blood vessel that has been broken in some way, and now there's blood coming out.
And are you also familiar with another term, part of that term, known as a punctate contusion?
Yes. So punctate is essentially just a way to describe the size of a contusion. When I say punctate, I mean something that's very, very tiny. It almost just like a dot.
And with respect to punctate contusion, what, if anything, did you observe in Mr. O'Keefe's brain, and where was it located?
So there were punctate contusions in the frontal and temporal cortices. So frontal, once again, is the front portion right here. Temporal is kind of right behind it in this area. And the cortex is the gray matter of the brain. So it's a thin strip that kind of just goes around the brain. And then the white matter is underneath all that. So in traumatic injuries, you can see punctate contusions or even larger contusions in the cortex. It usually indicates that the brain has been pushed against something, which is now causing these little blood vessels to rupture, hence seeing the contusions, because the blood is no longer contained in the blood vessels.
Now, doctor, with regard to the subarachnoid hemorrhage, is there anything that you're able to do as far as...
Sorry, babes, got to stop it one more time. So the brain from these punctate contusions that she has noted, frontal lobes, that the brain was pushed very hard against something. So, okay. So him being hit in the back from 6 feet falling, right? Him just going boom, allegedly, per the Commonwealth's theory, would never, ever, ever, ever cause the damage to the brain that Officer John O'Keefe sustained. Okay? Okay. I'm going to need everybody to collectively take in a moment and just say, how scary is it that there are certain individuals that actually believe that Officer John O'Keefe fell, tripped, was struck at a low speed impact in reverse and either fell on concrete, not from a 12-story building, babes, just fell down and caused this type of devastating, fatal cranial injuries.
measuring that?
It's hard to measure because it's usually pretty vague. It's not usually something that is a well circumscribed, meaning I could say it starts here and ends here. A lot of times with subarachnoid hemorrhage, because it's sitting in this space that it's not supposed to be in, it can spread. So it may be thicker in one area, thinner in another. So you may have some that may appear just as a very faint hemorrhage, and then some that might be very thick, which you can physically measure. So I usually just give an area where it is and say it's here, it's there, because it's almost like measuring something that has blurred edges. You can't really get a completely accurate measurement.
And what, if anything, were you able to observe or measure with regard to the subarachnoid hemorrhage in the area of the left prefrontal lobe?
So it appeared thicker in that area, meaning that as opposed to it looking just like a a faint red color that should not be that color. It was actually thick enough that it was obscuring the underlying brain parenchyma.
If I could turn your attention, doctor, just back for a moment to the punctate contusions that you were testifying about before. As far as your observations of those, was that one or more than one, or what, how many did you observe?
So there were multiple. There were multiple contusions to the point where it's not something that you can count. I mean, you could count it, but it would probably take a very long time. If it had been something like 1 or 2, 3, 4, maybe a handful, it would probably be something I would say there are 3 here, 4 there, but there were so many that it didn't serve a purpose to count.
And the number of those, what if any significance?
There was so many that she was unable to count. I could have said if there was 3 over here, 2 over here, 5. There was so many she did not count, babes. Okay. Okay. Just put that in the back. This is huge testimony.
Does that happen in regard to your analysis, your observations, or your opinion?
So given that there's multiple, it means that there's enough pressure in the brain that there were many surfaces that were pressing on the bony prominences of the skull, which was leading to a lot of blood vessels rupturing, causing these contusions.
Now, I think you've talked a little bit, but just in general terms, if you could describe for the jury, what is a hemorrhage?
So a hemorrhage is essentially blood that's coming out from a vessel. So it's like a bruise. Hemorrhage, bruise, contusion, they're fairly similar. Some people use them interchangeably, but it's essentially blood that's no longer contained in a blood vessel.
When something is termed medically, based on your training experience, as a diffuse hemorrhage, what does that mean?
So diffuse means it's over a very large area. It's not something that's just a tiny little area. You could say, okay, I'm looking at this person's, let's say, liver, and there's a 2 by 2 centimeter hemorrhage sitting right there in the right lobe of the liver. Diffuse would mean there's hemorrhage throughout nearly the entirety of the liver.
Now, with regard to, you made a note as far as there being a...
So guys, in this moment, that is Renee comparing Officer John O'Keefe's hemorrhaging in his brain as to a liver, and saying that if there was diffuse hemorrhage in a liver, it would be throughout the entire liver. And that she's basically comparing that, saying that there was diffuse hemorrhage throughout the entire, almost the entirety of Officer John O'Keefe's brain.
A diffuse hemorrhage within the pons, P-O-N-S, is that correct?
Yes.
Can you explain to the jury sort of what that means and where is that located within the brain?
So the pons is part of the brainstem. So the brainstem starts right in the middle of the brain, and you have the midbrain, the pons, the medulla, and then it turns into the spinal cord. So the pons is kind of in the middle of the brainstem. And when you have hemorrhage in the pons, in this circumstance, it was because there was the herniation of those onsi, which began moving closer and closer towards the pons, pressing on it, causing hemorrhage, because now the tissue is compressed. The blood is not going to be able to flow in and out freely, therefore hemorrhage.
Now, with regard to the totality of what you reviewed in this case in regard to Mr. O'Keefe, be able to form any opinions to a reasonable degree of medical certainty in regard to the injuries that you observed to Mr. O'Keefe's brain?
I was able to determine that these are acute traumatic injuries. I know that based on what I observed and in combination with the autopsy findings, that this is due to some type of trauma.
If I could ask, as far as you have certain findings as far as the intraventricular hemorrhage and occipital horns of the lateral ventricles, correct?
Yes.
If you could please explain to the jury what exactly does that mean?
Yes. So the ventricles are almost like a tunnel system of the brain in which the cerebrospinal fluid flows through. So the cerebrospinal fluid serves as a fluid that nourishes the brain. It provides a flow of nutrients, oxygen, things like that. And it starts in the frontal portion of the brain, and then it goes backwards towards the occipital, which is the back. And it also flows downward through the brainstem and then into the spinal cord as well. So the occipital horns of the lateral ventricles are in the back of the head, and having hemorrhage in those areas, in any area of the ventricular system, is usually indicative of some type of trauma. So there should not be blood freely flowing within the ventricular system.
Now, Dr. Stonebridge, with regard to your findings, you mentioned that your findings were that the injuries were acute and that the injuries were the result of trauma, correct?
Yes.
What, if anything, can you say or can you opine as to the mechanism for those acute traumatic injuries?
It was something that required some type of force, given that there were skull fractures. I can't say what type of force or how much force, but it was definitely something that caused some type of force, which led to the skull fractures and then the subsequent brain findings.
Okay, so Dr. Renee Stonebridge right here is saying, I can't tell you exactly how much force, but babes, I want you to watch her body language, okay? Because we're, talking bodies with Renee, and she is going to, I think, if I remember correctly, we're watching it really together for the second time, but we remember, I have an elephant brain. So I think that Lally asked her, because this is where I was like super into her testimony. And he said, I think he asked her, is it consistent with ABC? And just watch her answer, because she knows damn right well that this is a trauma. This is a trauma with a amount of pressure that would have taken to cause the impacts that were noted in her findings and the injuries sustained to Officer John O'Keefe were so grave, were so severe that Officer John O'Keefe had no chance, no matter if he was found 15 minutes later or if he was found at 6 o'clock in the morning, in my humble opinion. By the way that she has described this, his autonomic system, everything, his breathing, everything, the way in which she is describing, once these bleeds had reached the level of diffuse throughout the entirety, there is no resuscitative measures that would have resulted in Officer John O'Keefe living a life that he had previously lived, in my humble opinion.
And the brain findings in particular that you made, were those consistent with the fall?
They can be, yes.
Can they also be consistent with being struck by a vehicle and then going to the ground?
Yes, they can be.
Thank you, doctor. I have no further questions. Your Honor.
You're welcome.
Cross-examination.
No questions, thank you.
Are you kidding me? Yes, they can be from a fall, right, guys? Now, and yes, it absolutely could be from a fall, babes. A fall from a 4-story building, a fall from a balcony, okay? A fall from I don't even know, a ladder, like that is so high up. It could be consistent with that. Now, could it be consistent with a motor vehicle accident? Of course it could. If you are slammed into in your center of mass, full, frontal impact at 75 miles an hour. You know what Adam Lally didn't ask her? is this consistent with a fall on the ground from a standing position to the ground? He didn't ask her that because he knew she would have said no. He also didn't ask her, is this consistent with a reverse motor vehicle accident at a speed of approximately 24 a low impact accident at 24.2 miles an hour in reverse, sideswiped? Because she would have said, she would have eye twitched it. So when I tell you the sneaky bag of that, and if you watch, let's watch it back. It was only 30 seconds, babe. Watch Renee.
You're welcome.
Doctor, thank you.
What I observed, which led to the skull fractures and then the subsequent brain findings.
And the brain findings in particular that you made, were those consistent with the fall?
They can be, yes.
Can they also be consistent with being struck by a vehicle and then going to the ground?
Yes, they can be.
Oh, where you looking, Renee? Where are you looking, babe? Oh, I did. Did I do okay? Oh, Jesus Christ. Look at that pursed lips. Now, listen, I'm no body, whatever expert of her, like looking of, oop, what are we doing here? Okay. But that pursed lip leads me to believe I have a couple other things I could have said there, but I chose not to. Understandable, Renee. You are a Commonwealth witness. And he kept those questions so friggin' vague only to elicit that response, because she had to say yes, because it could be. Of course it could be. Anything is possible, babes. I could have been at 36 Fairview on January 29th, 2022. It's possible. Could be. You know? Like, what are we doing? And for the defense not to go directly back at this, oh my God, I swear to God, Mr. Yannetti, put me in, coach. Please let me write some questions down just for us to have, because we need to get to the bottom of this. You have to ask specifics, my guy. It has to be, is this consistent with, or have you ever seen findings like this from a motor vehicle, a pedestrian strike at low speed? Ever? You know what Renee's going to say with her 4 friggin' board certifications? No, I have never seen that. Never in my career. I guarantee you guys. You know what else Renee is going to say? They're going to say, is it consistent? Are the findings consistent with a physical altercation and a fight, a actual, maybe 2-on-1, 1-on-1? I don't know. Would this be consistent with a violent episode between humans? Yep, sure would. How about that 2.5-inch laceration to the back of the head? Where did that come from, Renee? And Renee would say, "Ooh, goodness gracious. I don't know, because I'm not sure how the surface area of one's head, of our craniums, when hitting the ground, wouldn't just make 2 inches, 2.5 inches, because more of his skull was touching the ground. So if his brain just, if his skull just had to, fracture open, lacerate in order for that injury to occur, where there is no rocks, nothing was found, he didn't fall, he wasn't on the ground or on the street, he did not smash his head backwards on that street. It does not make sense, babes, because Officer John O'Keefe did not get up after that. Trust you me, once the head happened. As soon as the trauma, blunt force trauma to his skull occurred, he did not get back up. The final trauma. Do I think it was one blow? No. Nope, I don't. There was multiple. as evidenced by subarachnoid hemorrhages, front, temporal, between your planes, diffuse hemorrhage, herniation of your brain stem. This is unequivocally the worst testimony that I can recall ever listening to regarding the nature and finding Officer John O'Keefe with the severity of these injuries, guys. Now, riddle me this too, babes. How does Officer John O'Keefe's brain end up so badly injured, but he doesn't have a bruise anywhere on the rest of his lower body? Doesn't have a fracture, doesn't have a break, doesn't have scrapes other than his right upper extremity. Tell me how this happened. Because if you're honest with yourself, anyone who's a Commonwealth supporter stalking me, how did that happen? You tell me how that happened, I would eat my words. But you never will tell me how this happened. Okay. All right. Focus, Waylon. Okay, here we go. So,
Thank you, Doctor. I have no
and
further
she's
questions.
You're welcome.
thinking, right?
Cross-examination.
I can't believe they didn't cross. They will next time. If there is a next time.
No questions, thank you.
You're welcome.
Doctor,
Oh, thank you, doctor. Okay. So, Kevin, riddle me this. Sorry. Okay, now let's do, what else, guys? What do we think? Tell me everything. Tell me your thoughts. Tell me how we feel. Oh, and I want to, let me go to my stars. Oh, look at this. Oh, baby fish mouth, aka Mia Beto. Thank you so much for becoming a member. I love your face. Chrissy Micron says, do brain neurons bleed more than what we would expect internally? Do brain neurons bleed more than what we would expect internally? I don't think so, Lovey, but we just bleed the way that we're internally. I'm so sorry. And then yes, BLT, we have Mr. Nurse Kim. He just hid right behind Chloe. And he brought me my tea. Oh, Dewey, thank you so much, Lovey. It says, Nurse Kim, I know it's not neurology question, but has anyone, I mean, who, if anyone, talked about the difference of 4 hours and 6 hours in those temperatures? Babe, no, nobody has. Dewey, look at you. Just magic, Dewey. We've got to talk all the shit, babes, because it is another thing that I am going to forever live on a prayer with, right? Is the fact that Officer John O'Keefe did not have signs or any staging of frostbite. But you're telling me that he was in 18 degrees, between 18 degrees and 22 degrees, right? Was the temperature that night, without a coat, without a hat, without mittens, and he had no signs and symptoms of frostbite. Impossible, my friend. We'll take this a step further. Officer John O'Keefe was considered a viable candidate for resuscitative efforts upon the arrival of Anthony Flamati and Timmy Nuttall. What? Because had they said that this man has been, egregious cranial wounds, no signs of life, he's flatlined, he has nothing, okay? No signs of life, allegedly. He could have been pronounced at the scene and not transported to Good Sam. If there was lividity, if there were more than a specific number of signs in the field, we pronounce on the scene and do not transport. So where was he? Because he wasn't in a yard being snowed upon for almost 6 hours. I'm telling you that medically does not work. And also, why did none of these medical that is weird, because Scorty Bello never even talked about that. And the fact that he didn't have pooling in the, so if you're laying down, babes, right? And you're on your back and you are just, unfortunately, unaliving, it's happening. It's all happening. And we start to get pooling at the back of wherever we're laying, right? Because that is the way that it works. There was none. Zero. Zilch. That doesn't make sense. I love your face, Dewey. Okay. What would be Kate says, hi, Kate. Hi, Lovey. What would be a good analogy to use to explain the significance to the injuries? Okay. This is so good. Kate, I'm going to have to really think about this. But I would say I would say that a significance to get a correlation to the injuries that had occurred in Officer John O'Keefe's brain and his brain stem, these herniations, these pons, the unsi, the diffuse hemorrhage, the subarachnoid hemorrhages in multiple planes and of his brain. It is so traumatic that, to me, it would appear that maybe if you were struck by a vehicle head on, right, head on, at, I would say, at least 60 miles an hour, potentially more, and then projected to another area. So you're hit head on, you're going to be smashed, and then your brain is going to do a little bit of a, because it's going to move back and forth. We have a little bit of room in our brain, right? So if swelling occurs, and unfortunately you need to do a burr hole or whatever it is, those that's a protection, right? And you have a little bit of wiggle room, not a lot, but for his brain to go back, forth, and then to land on a very hard surface and smack another area of your head, whether it be the occiput, the temporal lobe, or wherever. That would make sense. If he's hit in multiple areas and projected, that would make sense. Or let's say if he is fighting with somebody, right? He's upstairs in a home. He is in a room, gets punched in the face, okay? And then falls out of a window. So he gets an initial injury here, falls out of a window and hits from gravity and force, causing such injuries that would occur that way. Or he was hit multiple places by multiple people and objects. That would make sense. You know what wouldn't make sense? That he was struck in his arm, that he spun and fell on the ground and caused those injuries. It does not work. Okay, loveys. Now let me go right here. BLT. Woo! Hi, Lovey. On Dateline, AJ tapped the tail light and said, you can hear how hard it was. An arm could never shatter that. Dr. Badass would be talking about brain stew if he hit the ground from the same level of force. I'm telling you guys, you're absolutely right, BLT. That is an incredible comment as it relates to if he hit his head from that same level of force, there would have been more external injuries to show that it occurred. That's where I'm trying to go with this, guys. The outside would have represented what happened on the inside, and it didn't. Why? Why? Why did nothing else on Officer John O'Keefe's body look like that? Why? I don't know. Because that does not, I cannot make my brain wrap around and say, absolutely, the Commonwealth has it right. If I thought the Commonwealth was right, guys, I would be a Commonwealth supporter. But I'm not. And it's based on this and this alone. Officer John O'Keefe's injuries will never align with a pedestrian strike. No matter how you slice it, Karen Reed is factually innocent. I don't have to say shit about anything else because that's reasonable doubt for a jury. God damn, we've got to say that. Let's say that at closing. There's a line, AJ. You know what I'm saying? If you have questions about a taillight being found for 3 weeks, 45 pieces, reasonable doubt. If you have questions about ignition cycles and where they are, just questions, that's a reasonable doubt. If you wonder how the timeline of the Commonwealth started at 12:45, but then backtracked to Karen Reed striking Officer John O'Keefe at 12:31 because she was connected to One Meadow Wi-Fi at 12:36, that's reasonable doubt. If we see that Officer John O'Keefe took steps after Karen 100% was out of the vicinity and traveling back to One Meadow, that's reasonable doubt. Because no matter what it is, even if you want to say that Officer John O'Keefe was traveling down a windy road or some shit happened, right? Or an elevation change, you still said he was in possession of the phone at that time. And if Karen wasn't at the house, that's reasonable doubt. She didn't do it. You don't have to believe every bit of the conspiracy, every bit of what happened. I've never claimed to know shit about what actually happened at 34 Fairview, other than Karen Reed's vehicle did not cause the mortal wounds and death of Officer John O'Keefe. Period. In my opinion. Okay, loveys. What did the Commonwealth think they would gain from her testimony? Ruth, awesome question, Lovey. I think that the Commonwealth brought Dr. Stonebridge up because she's a badass. She did his brain dissection. She completed the extremely specialized care and the portion of Officer John O'Keefe's autopsy that points to blunt force trauma impacts and all of the injuries. I think that she just was there to be the medical, sprinkles on the cake, and then for Lally to get those last questions in. Now, would have been incredible. Chef's kiss, wrap this babe up in a bow, had Eliza Little or David Yannetti said, hey, we actually need, we're going to ask you a couple more questions, because she would have given a straight shooter answer to anybody. And yes, if you're dealing with somebody who is a quadruple board certified physician and you don't have a medical expert on your team, or you're not calling another neuropathologist who did the actual dissection of Officer John O'Keefe's brain, maybe you steer clear of it because nothing affected or injured or impacted Karen from her testimony. But it was a lot of info to take in, and it was not expressed how, in my opinion, I don't think that the jury or anybody in that courtroom that didn't work as a medical professional or was a doctor or was an EMT or a nurse would never look at that and go, oh my gosh, this is the worst injuries I've ever heard of from for a patient having, So I think they were just trying to do the best that they could, and she wasn't doing anything wrong. She's only providing facts. Facts matter, journalism. Okay, and then Participate and speculate says, I don't remember. Did they ask this kind of trauma would have had any chance of survival? They did not ask her that, Lovey. And good as citizens, I love you. Thank you, Lovey. I always appreciate you and your platform. Thank you so much. I appreciate you and your platform and your little duck with curlers in. Stop it. I'm obsessed. Oh, and then Scooter. Thank you, Scooty 44 for 54 for becoming a member. Okay, now let me, who am I? Where am I? Find the other humans. Okay. Oh, Lord. Joe Biffle, be nice in the chat. Okay. And now, guys, this is basically what we are, going through today, right? That was it. I just wanted to do a little run through. I've got a rehearsal dinner that I've got to go to tonight, but I needed to talk to you. I needed to see your faces because I missed your faces so much, like legit. I was like, oh my gosh, I haven't been on in forever. And to anybody who went to the Halloween party last night, I hope it was wonderful. I hope you had the best time ever. And you guys are just very important to keep rallying, to keep your spirits up, to not allow the haters, the trolls, these people who are so unhinged to affect you. I should take my own advice because I was slightly affected this week, just feeling like badly that somebody said that I caused an emotional problem for someone I never would want to. So, but I think they were full of shit up to their eyeballs, and my empathy will only get me in trouble. So at the end of the day, I know who the fuck I am. I know who the frig you are. I love all of you. And I think that we should do, if we shall, I would really like to do Flammati's testimony again, guys, because that was magic. When I tell you, pure magic of hearing him. I mean, this is an expert EMT. So was Timothy Nuttall. And they sat there and provided this information where now we're able to see what Dr. Stonebridge told us happened, guys. She told us what the injuries were that were sustained inside the brain of Officer John O'Keefe. And now if we go back and we see what Anthony Flammati said, we're going to say, well, I believe everything that he said. I believe every single thing he said as it relates to how Officer John O'Keefe presented, babes. And if we go through that with a fine-tooth comb, we're going to say one of these things is not like the other. And how does that make sense? How is this going to work in to the Commonwealth's theory? Would we be able to ask different questions at retrial? Yes, we would. All right, tell me what you think. Oh my gosh. And then I wanted to say quickly, sorry guys, this is hilarious and I must say it. Oh gosh, where are you? I wanted to thank, stop, get a life. Oh Lord, Kim. Nope, that's not it. I don't know where it is, but I got an email about it. Yes, here it is. I got a, Cash App from Matt McCabe that sent me $5 for Chloe's beach bod. Okay. I can't. I cannot. And thank you, BLT, my fellow RN. I love your face. Okay, guys. So if we are into it, just let me know. Leave me a little message. Okay. Leave me a little boop boop down here. And we'll do Flammati tomorrow before a wedding. Let's just keep on keeping on. And I'll just do the medical parts because like that, I feel like, yes, we could go through witness testimony all day long, right? And be like, I think this or this, but medically speaking, we've got a leg to stand on and we can keep we can keep our, just keep on keeping on with it. I don't know what I was trying to get at there. We can keep working with science. There it is. We are not worried about opinion. We are looking at medical science. That is what we give a shit about. I give a shit about what you said. I give a shit about how Officer John O'Keefe presented, and I give a shit of how this evidence matches up. That's the only thing I care about. Solely. Okay? Okay, loveys. You tell me what you want to do later. Thank you, as always, for answering my FaceTime. This was unhinged. This was wild. This was a random Saturday morning with me in pajamas and my little pearls, okay? But I love everything about you. I thank you so much, and I'll see you tomorrow. Let me know what time we want to do this, too, because I can't do it at 6 o'clock because I have a wedding. But I can do it before. You let me know when works for you. Okay. Bye, babes.